generally speaking, is two types: internal or closed, bleeding inside the body, and external or open, bleeding outside the body. Both types can be serious and should be treated promptly, or else shock can develop, leading to death. Internal bleeding, also called internal hemorrhage, is a loss of blood that occurs from the vascular system into a body cavity or space. It can potentially cause death and cardiac arrest if proper medical treatment is not received quickly. These internal injuries require expert treatment urgently, and every effort must be made to deliver the casualty to the medical care. The signs and symptoms of internal bleeding depend upon where the bleeding is located, how much bleeding has occurred, and what structures and functions in the body are affected, such as bright red color from the mouth or rectum or blood in the urine, non-menstrual vaginal bleeding, bruised, swollen, tender, or rigid abdomen can be caused by internal bleeding from trauma in the liver or spleen. These symptoms get worse as the bleeding continues, such as swelling, tightness, and pain in the chest are signs of fractured ribs. Blood seen in the urine may be due to internal bleeding at any site within the urinary tract from the kidney to the bladder. Signs of abnormal pulse and difficulty in breathing, large areas of deep purple or moist skin, and even vomiting or coughing up of blood are indicators of internal bleeding. Lay the victim down with his head low to one side to ensure a good blood supply to his brain and prevent aspiration if vomiting occurs. Lose any constricting clothing around the neck, chest, and waist. Reassure him or her and explain the necessity for him to relax. Ensure to check breathing and pulse rate and level of responsiveness at 10-minute intervals. Examine the victim for other injuries and treat as necessary. If he becomes unconscious, keep his airways open and check breathing and complete the ABC. Always keep the victim covered and place a blanket underneath him, and keep a record of any specimen passed or vomited by the victim. Bruises treatment. Ice should be applied immediately to an area that is injured to reduce swelling and diminish the black and blue discoloration of bruising for 20 minutes. If the bruise is on an arm or a leg, raise the limb if it is not broken. Ice packs may be alternated with a heat pack for the next 48 hours. Although bruising may be reduced by this method, some discoloration will still be visible. Caution: do not give a victim anything to eat or drink. It could cause nausea and vomiting, which could result in aspiration. Food or liquids could cause complication if surgery is needed. Because of its nature, external bleeding is easier to detect than internal bleeding, obviously by the fact that a sticky red stuff is leaking out of a hole in the body and getting everywhere. Blood oozes from an open wound. It usually stops by itself or when a dressing is applied. The volume of blood loss depends on the number of blood vessels damaged. If controlled appropriately, it should not be life-threatening unless arteries or other organs are involved. When large arteries are damaged, bright red blood will spurt from the wound in time with the heart beats. If someone has severe bleeding, the main aim is to prevent further loss of blood and minimize the effects of shock, and always seek medical help for the bleeding unless it is minor. External bleeding is generally described in terms of origin of the blood flow by vessel type. Let's learn together. Arterial bleeding, venous bleeding, and capillary bleeding. Arterial bleeding, as the name suggests, blood flow originating in an artery. With this type of bleeding, the blood is typically bright red in color due to high degree of oxygenation. Blood typically exits the wound in spurts rather than a steady flow. Here, the amount of blood loss can be copious and can occur very rapidly. Venous bleeding. Here the blood is flowing from a damaged vein. As a result, it will be dark red in color. This is due to a reaction of oxygen being transported and will flow in a steady manner. Caution is still indicated. While the blood loss may not be arterial, it can be still quite substantial and can occur with surprising speed without intervention. Capillary bleeding usually occurs in superficial wounds, such as abrasions. The color of the blood may vary somewhat and will generally ooze in small amounts, as opposed to flowing or spurting. Regardless of the type of bleeding or the type of wound, the first aid is the same. First and most important, you must control the bleeding. Click on the tabs to know more. Protect yourself against disease by wearing medical exam gloves. If they are not available, use several layers of gauze pads, clean cloths, plastic wrap, a plastic bag, or waterproof material. Expose the wound by removing or cutting the victim's clothing to find the source of the bleeding. Place a sterile gauze pad or a clean cloth, such as a handkerchief, washcloth, or towel over the entire wound and apply direct pressure with your finger or the palm of your hand. Hold steady, firm, and uninterrupted pressure on the wound for at least 5 minutes. The gauze or cloth allows you to apply even pressure. Direct pressure stops most bleeding. Be sure the pressure remains constant, is not too tight, and is applied to the bleeding source. Do not remove blood-soaked dressings. Simply add a new dressing over the old ones. If the bleeding is from an arm or a leg, elevate the injured area above the level of the heart to reduce blood flow as you continue to apply pressure. Elevation allows gravity to make it more difficult for the body to pump blood to the affected extremity. Elevation alone, however, will not stop bleeding and must be used in combination with direct pressure over the wound. Wrap a roller gauze bandage tightly over the dressing and above the wound site. If the bleeding continues, apply pressure at a pressure point to slow the flow of blood as you continue putting direct pressure over the wound. A pressure point is where an artery near the skin surface passes close to a bone against which you can compress. Take time to reassure the victim that everything possible is being done, and do not belittle the victim's concerns. If you suspect a broken bone, especially in the head, neck, back, hip, or upper leg, see severe bleeding, or see a bone protruding through the skin, call emergency services immediately. If the patient is bleeding severely, get him under control first, or better, send someone else to call. Know the signs and symptoms of a fracture. This is the first step before you can begin anything else. You cannot start treatment when you do not know what you are treating for. These are signs and symptoms for a conscious patient. Ask the patient to explain about the accident or incident, what it was and where it was, and the ensuing snap that was heard and felt by him. The patient will be able to pinpoint the exact location of the pain and tenderness. There will be an inability to move that part of the same range of motion that was there before the accident or injury. The patient may also tell you that he can feel his bones rubbing together, which is called crepitus. This is another definite sign that a fracture or a break has taken place. Abnormal movement might also be reported in the area of the body where the accident took place. Remove or cut away the patient's clothing around the area of the injury. Keep in mind the patient's privacy and dignity, and only remove what is necessary. If the patient is bleeding heavily, and especially if blood is spurting, stop the bleeding as much as you would any other wound, generally by pressing firmly with a cloth or even your hand. If there is no blood loss danger, avoid putting pressure on an open fracture, as this could cause more damage than what you're trying to fix. Avoid washing the wound or probing or palpating it. It is obviously sore to the touch, swollen and discolored. Given the other signs and symptoms, consider this to be a fracture and take the patient to the hospital. Cover the entire wound with a large sterile bandage or pad if a piece of the bone is protruding through the skin. Never stick your finger or an object into a hole where the bone is protruding or otherwise. Do not attempt to push the bone back in place or otherwise set it yourself. Never try to replace missing bone fragments. Call emergency services or transport the patient yourself to the nearest hospital. The injury should be shifted as little as possible. An ambulance would be much better for a serious injury to avoid worsening it and to have someone available for any complications that may arise. The socket may bleed after the extraction of a tooth. This kind of bleeding is seldom serious. At least 2/3 of the blood which is spat out will be saliva, so the blood loss is unlikely to be great. If the gum margins are splayed out, squeeze them gently together and close up the tooth socket. Fold a piece of gauze tightly and place it in the socket so that it is standing proud of the level of the remaining teeth. The casualty should close the mouth, biting firmly on the gauze in the tooth socket. The pressure should be maintained for at least 20 minutes. If the socket is still bleeding on removing the gauze pad, the procedure should be repeated as often as necessary. Hold the tissue to your nose. The first thing to do is make sure you pinch the fleshy part of the nose. Grab the closest tissue or paper towel and hold it up to your nose to stop the blood from getting everywhere. Pinch your nose to prevent a long-lasting nosebleed. Don't blow your nose, since this can make the bleeding worse. If the bleeding is heavy, you may need to use an absorbent cloth towel. Get into a comfortable position. Sit down in a chair and lean slightly forward. Your inclination may be to lean back to work against gravity and stop the blood from flowing so quickly. But if you lean back, you risk swallowing the blood, which can lead to an irritated stomach and even vomiting. Resist the temptation to lie down, for the same reason that you shouldn't lean back. Lying down could cause you to swallow blood. If you want to remain standing, you can, but it's better to relax your body by sitting down for a few minutes while you get control of the nosebleed. Lean forward and use your fingers to pinch your nostrils shut for 10 minutes. Doing this should help the blood clot and stop running the way it does when you hold a bandage to a wound on your skin. Medicated nasal sprays can also help stop the flow. If you have a nasal spray, such as Afrin on hand, spray your nose with it before you begin pinching. After 10 minutes has passed, release your nose and determine whether it's still bleeding. If the blood is still flowing, resume pinching your nose for another 10 minutes. Apply a cold compress over the bridge of your nose. If pinching doesn't seem to be stopping the bleeding, a cold compress could cause the blood vessels to constrict, slowing the bleeding. Try one of these methods. Wet a washcloth with cold water. It's not as cold as it could be, but it's more comfortable than ice on your skin and it should help. Make a quick ice pack. Put ice inside a resealable plastic bag and hold it on top of your nose. Crushed ice is ideal, but cubed ice works as well. Keep frozen sponges handy. If you tend to get nosebleeds often, this trick can save a lot of time. Get a new kitchen sponge, add a bit of water to it, and put it into a resealable plastic bag. Put the bag in the freezer and pull out the sponge whenever you have a nosebleed. It'll be easier than hassling with ice cubes while you're bleeding. Know when to call your doctor. Most nosebleeds aren't serious and don't require emergency medical care. In some rare cases, nosebleeds are caused by something other than a slight tear in the skin. So see a doctor if you experience the following. If you're still bleeding after 20 minutes, or if the bleeding started after a head injury, or when your nose was hit, and you suspect it's broken.
Most external bleeding will be minor and usually stops within 10 minutes through the blood clotting. For minor bleeding, apply direct hand pressure to the wound until bleeding stops. Clean if necessary and then cover with a clean or sterile dressing. Sometimes, though, bleeding may be life-threatening if the damaged blood vessel is large or the blood is under too much pressure for effective clotting to occur. To manage major or deadly bleeding, examine the wound for embedded objects, apply pressure to stop the bleeding, elevate if possible, restrict movement, and ideally immobilise the part. A significant amount of bleeding may occur with wounds to the head and face. Bleeding is usually controlled with direct pressure, but care must be taken to avoid pressing onto a possible fractured skull.
Here. It's all right. It's okay. It's a bit spongy. Yeah.
Assess the surrounding area. If a depression, sponginess or bone fragments are felt under the skin, do not apply pressure directly onto the wound. Attempt to control the bleeding with pressure around the wound, perhaps with a donut bandage. Once a fracture of the skull has been eliminated, direct hand pressure may need to be maintained because of the difficulty of bandaging the head firmly enough to control the bleeding. To treat a person with a nosebleed, sit the casualty with the head forward. The nostrils are pinched over the soft fleshy area at the end of the nose bone for at least 10 minutes. Instruct them to spit out any blood, breathe through the mouth, and not to blow the nose. If bleeding continues, reapply pressure for a further 10 minutes. If bleeding persists, seek medical attention. When a tooth is knocked out, control the bleeding first, and once controlled, try to save the tooth. Instruct the casualty to bite down firmly on a pad placed over the tooth socket. To preserve the tooth, it may be sucked clean or washed in the casualty's saliva or in a little milk. Water should never be used to wash the tooth, nor should the root of the tooth be handled, as it may cause the tooth to die.
Off to the dental hospital.
In the event of an amputation, firstly manage the stump by applying direct pressure and elevation, then provide rest and reassurance to the casualty. Manage shock, then care for the amputated body part. Retrieve the part and place it in a sealed plastic bag without washing, labelled with name of the casualty and the time of amputation. Place the sealed plastic bag into a container of water and ice and transport with the casualty. When a foreign object, such as a knife, glass, branch or stick, is embedded in a wound, do not remove the object as it may be acting as a plug. Apply pressure around the object using a donut bandage. Penetrating, embedded or puncture wounds and any bites have a high risk of becoming infected, and medical treatment needs to be sought.
Caution: do not apply a pressure bandage so tightly that it cuts off circulation. Do not use a tourniquet. They are rarely needed and can cause nerve and blood vessel damage. The use of a tourniquet may cause the loss of an arm or a leg. In this section, we have understood the basic anatomy and physiology of the circulatory system. We have also learned about the internal bleeding and external bleeding, where both these types can be serious and should be treated promptly, or else shock can develop, leading to death. The signs and symptoms of the bleeding depend upon where the bleeding is located, how much bleeding has occurred, and what structures and functions in the body are affected.